Hello, everyone. It's truly an honor to be here, and thank you to Tori for putting up such a great conference, as she and her team always do. And it's an honor to be part of it. My name is Pradeep Goel. I'm the CEO of a company called SolveCare, and we are a healthcare platform company intent upon making healthcare and the business of healthcare work better. And we have a very interesting and exciting topic to cover with you, somewhat controversial, somewhat provocative, but I think you will find it very useful because ultimately we are all here to deliver better care at the highest possible value to the patient and society. And I've spent my entire career, over 30 plus years, like many of you, in trying to make healthcare work better. And I think what we have to share with you today will be a thought-provoking alternative view of looking at things and perhaps taking a step forward towards changing things for the better. So without further ado, let's get started. So the topic that Tori has chosen for me is fun. It's controversial. What is the appropriate use of cryptocurrencies in healthcare? And by extension, what's the proper use of blockchain in healthcare? Is it real or is it just hype? Is it just risk or is there any reward? Should we do it now, maybe later, or never and run away? And let's talk about all those things over the next 30 minutes. So first thing to talk about is healthcare itself. All of us know this well. Healthcare is regulated. We're not allowed to take too much risk, particularly when it comes to patient lives, but we're also not allowed to take risk in terms of how we spend other people's money. So there is regulation, there is risk averse, and there's also the factor that most of healthcare payments are third-party governed, be it Medicare or Medicaid or insurance or employer-sponsored benefits. We always have a third party who is looking over the shoulders of the patient and the provider and trying to make sure that things are being done in the right way, for the right price, in the right sequence. And all those things make healthcare particularly averse to something wild and crazy like cryptocurrencies. And when you think of cryptocurrency, what comes to your mind? It's a wild west. I don't know who issued this currency. I don't know what it's backed by. One day it's worth X, the next day it's worth 0.X, the next day it's worth 10X. And then what is it based on? This whole crypto blockchain technology, it's incomprehensible to most people. So how can I trust something I don't understand? But that's not the point. We don't always understand how the combustion engine works to be able to drive our car. So let's talk about, is there a real use case for cryptocurrencies in healthcare? And when I say the word cryptocurrencies, I mean more than cryptocurrencies. I mean the concept of having a digital asset on something called the blockchain technology, which is immutable and shareable and replicatable. So cryptocurrencies are simply a popular term for a whole new technology, and that's what we need to talk about. But before we do that, why even bother? Healthcare and crypto, same sentence, what an oxymoron. One is all risk, the other is risk averse. One is completely unregulated, the other is fully regulated and overly regulated, one might argue. And in one case, we cannot afford to deal, and we look to minimize the unknown, and crypto seems to be all about the unknown. So is it really worth even talking about these two in the same sentence? Absolutely is. Because we can actually use the technology behind crypto to make healthcare function a lot better. Let's start with payments. Crypto or blockchain and digital assets are clearly an excellent opportunity for us to improve payments, be it direct payments or be it third-party payments or be it multi-party payments. This technology represents a huge, huge potential to improve the way payments work in healthcare. But there are some other very interesting use cases of healthcare that blockchain and digital assets address. Identity verification. How do we know the other side, who they are, without having to check their ID individually and repeatedly? Whether the relationship is between a patient and a doctor, or a pharmacy and a prescription, or a payer and their member, or a primary care physician referring to a specialty care physician. On both sides of this relationship in healthcare, there is a need to verify the identity, and by extension of the identity, their credibility and their credentials. And digital assets can become a very simplified, immutable way to verify identity. We'll talk about this in a minute. What about consents? Remember the forms we have to give to our patients when they arrive in the clinic, and all the forms we have to collect and store forever. And to prove that we have all the consent from the patient or from the employer or from the employee or from the payer, those consents can be totally digitized without having to rely upon a single authority. And then there is the big question of medical records. I have custody, but do I own your records? Just because your records are in my custody, does that make it my responsibility to deliver them to whoever you want me to deliver to them? Am I a custodian, or am I a responsible for perpetual record sharing? All those questions about who owns, who holds custody of, who's responsible for sharing, and who's responsible for receiving, all those questions of healthcare medical records can be totally simplified by using digital assets. And these are just 4 simple, fundamental changes to healthcare that we can apply with digital assets and blockchain technology. There are dozens more: patient enrollment, discharge, prescription management, coordinating care between parties that are not directly connected on a single EMR, and on and on and on. But I picked 4 use cases for you to understand that payment facilitation between 3 parties, patient, provider, and payer, can be dramatically simplified. Identity verification without having to go repeat the identity verification by every party. Consent management and sharing of that consent in a way that we can simplify the liability and the risk around consent. And easier and more fair record management. These are just very simple, powerful use cases of crypto. And when you apply these principles of digital asset-based eligibility verification, or billing in or out of the network, or managing copay and deductibles, it becomes really financially attractive, because we know that we spend far too much money on managing care than on delivering care. And if we can reduce that expense, which many will argue ranges between 20 to 30% of our annual spend, all these hated procedures of pre-authorization, eligibility verification, calling the payer, or billing in or out of the network, or confirming the copay, or ensuring that the deductible has not been met, and so on. These are all very easy use cases for crypto or digital assets and blockchain to manage. So how can digital assets do that? I mean, what's the magic here? Pradeep is sitting here saying we can improve these very administratively difficult processes. How are you going to do that? What magic do you have? Well, the magic is actually pretty simple. A digital asset is a highly traceable asset, right? A digital asset is like a certificate or a bank check, except that that check is linked to something very specifically. So we can easily issue a digital asset that's linked to a person's identity. Inside that asset can be information about the person's driver's license, their social security number, their passport, anything else that we want, their patient ID, their Blue Cross Blue Shield insurance card, whatever we want to link to the identity of a person, we can link that inside an asset, put that asset in that person's wallet, and allow for selective sharing of that asset with another wallet. And because this asset cannot be altered without detection, we can be sure that when I receive a digital asset containing someone's identity, I'm looking at a complete unaltered identity as if I was looking at their passport or their driver's license, but I don't need to have their passport or driver's license in front of me to know that the asset is true and valid, because the asset is immutable. You can trust it. Same thing we can do. You can take the same digital asset, people like to call them tokens, and link it to a service. If I perform this service, I can then, in response to that service, cash in this digital asset. So in other words, I can have a pre-authorization token in my wallet. I can have a referral token. I can have a digital asset that gives me immediate payment for a predetermined non-adjudicatable claim. So a digital asset can be linked to an identity. It can be linked to a service. Similarly, if you take the concept further, it can be linked to a relationship, such as this is an in-network relationship, or this is an out-of-network relationship, or this one requires a copay, and this relationship requires a referral. So you can create digital assets as easily as you can link them to an identity, as easily as you can link that asset to a relationship in healthcare. And healthcare is all about relationships, patient-provider relationship, payer-physician relationship, employer-employee relationship, primary care specialty relationship, physician-pharmacy relationship. These are all relationships governed by rules in healthcare. Those rules we live by. Those are the rules we must follow to comply with both regulatory and clinical and administrative guidelines. Those relationships can be easily programmed in the asset. So then that asset can move between people, but preserves the behavior of the relationship. So for example, if my asset in my wallet says that Dr. John referred me to a cardiologist, then that asset, when transferred to a specialist, would carry with it the reason for the referral, who the referral is meant for, and it will also interact with the wallet of the person who received the asset to say, wait, you are not a cardiologist. I cannot be referred to you. We can do this in a completely decentralized way where things become a lot easier, a lot simpler to run. Let's take it to its natural conclusion. You can link a digital asset to an event. Pradeep came to see Dr. John. That visit was completed. I paid $25 copay, but that event of a visit triggers an asset that I can send to the insurance company for them to either adjudicate or pay the visit. It can therefore guarantee real-time payments because a consent and the proof of that transaction or that encounter is in the asset, and we just send the asset or essentially cash the asset and get the payment. And the cashier in this case is the payer. So all these processes that we are currently used to doing by email or phone or fax or logging into 25 different eligibility websites and submitting claims through a revenue cycle management company, all these processes, instead of being process-oriented, become guaranteed assets, which can be relied upon both by party A, who issued the asset, and party B, who received the asset. So when you think about it in that common, simple sense, blockchain technology allows us to issue digital assets of any kind. Bitcoin is just one type of asset which people attribute value to. We can issue a digital asset for identity, for event, for process, for relationship, and for bills and payments. And when you start using that as an example, rather than worrying about the tech stack of blockchain, things become very exciting. Now, what we have done at my company is built a whole platform similar to EMR or eligibility and enrollment or revenue cycle management systems that use these digital assets in all these different ways that we have described. So similar to how electronic medical record systems or electronic health record systems are designed to handle care journeys and care records, eligibility and enrollment systems are designed to handle benefits and your eligibility and participation in benefit plans, and revenue cycle management systems are designed to handle billing and payments. We built a platform to handle healthcare relationships using digital assets. And it's a very complete platform, which allows you to do the job that you are used to doing today in a very process-driven way into a very digital asset-driven way. So in a nutshell, this is how things would work. Both the sender and the receiver of the asset would use a wallet. So in your mobile phone or on your desktop, you have a wallet. Our wallet is called Care Wallet. And this is how we interact with each other, whether we want to chat or share records or send a bill, receive a payment, or send a payment, get a confirmation, send a prescription. Any transaction between two parties happens in the wallet. The way they transact with each other is they send a digital asset called Care Card. That Care Card is a care card, like a physical piece of paper or a 4x3 lined card you can buy in a dollar store. And that care card contains content. It can contain a prescription or an appointment or a medical record, or it can contain an instructional video, or it can contain guidelines on nutrition. It can contain discharge summary, or it can contain consent to bill my insurance company, or a informed consent to perform a procedure. That care card is a digital asset that can be moved between wallets with a swipe. Those care cards, when they move between wallets, record that movement on something called a blockchain node. So whenever cards are exchanged between wallets for any reason, they are written to the blockchain for immutability. So nobody can deny or tamper with the card. So when I send you a card containing my identity, that card is meant for your wallet. You can open it, but nobody else can. But there's also a proof that I sent you this card, so that I cannot later deny having sent you the card, because in the wallet. There is no need for you to worry about auditability, because you can just look at that card and discard it, but the fact that I sent the card to you is always on the chain forever and ever and ever. So there is no room for dispute. But the card content is only in my wallet or your wallet. So we didn't expose PHI, PII. We don't want to take any, we don't want to expose information that HIPAA doesn't allow, nor do we want to do that as on a moral basis. So content stays off the chain, but the fact that the cards were exchanged and the type of card was exchanged goes on the chain. All of these exchange of cards can be further controlled by something called the protocol. So if we don't want to permit certain types of cards to move between certain types of wallets, we simply define them in the protocol. And if we want certain cards to absolutely go from wallet A to wallet B and respond from wallet B to wallet A, then we can put all that in the protocol in a matter of minutes. And you can reprogram a hospital. You can reprogram an insurance company. You can program a complete new Medicare or Medicaid system. You can program the chip program, the system. Any business process that you are currently doing with your electronic medical system, record system, or through your, as I was in insurance space, eligibility or enrollment or member management or claims adjudication or payment systems, all those processes can be much more simplified in this model of peer-to-peer, wallet-to-wallet transaction capability. And underneath all that is this blockchain, which you don't care about because it's a tech stack that empowers everything about. So we have taken the time over the last 6 years to build this entire ecosystem on which you can reimagine healthcare, transaction by transaction, role by role, relationship by relationship. Now, what does that all mean? It means that you can build digital health solutions of the kind that you cannot conceivably, financially, and technologically build without such a platform. You can build a multi-party network where every party has a role which defines the cards in their wallet. You can easily configure their relationships. You can define what they must do and what they must not do, what they can do, what they cannot do. And all of that can be built within days, leading to an enormously powerful ecosystem of healthcare delivery that exceeds any current system capability that's out there today. Empowering all that is this incredible object, a highly programmable digital asset object called Care Card. A Care Card is an incredibly flexible digital asset that you can quickly configure to work the way you want it to work. First is a multi-dimensional object in the sense that you can have different sides to the card. Each side has a different purpose. You can have public data, private data, consent, information, security, sharing, and the card can unfold. You can peel it like an onion, but you can send this card between wallets with only the sides that you want to share. So you have this incredibly powerful, incredibly configurable object, digital asset called Care Card, which you can move between wallets based on the protocol, and which you can configure to carry whatever content you want to get or want to send. So I could configure a Care Card to request medical records from my patient, and they can attach medical records to the card, send it back to me. And simply by doing that, I have created a completely immutable electronic medical record system with no centralized authority, and everybody's protected. So this is the building block. So I want to take you back to cryptocurrencies and healthcare. People think of cryptocurrencies as Bitcoin, but in reality, digital assets can take any form. And what you see on screen is a digital asset. It's not Bitcoin. It's intelligent data and information and consent object that you can send and receive. And it's no different than sending and receiving Bitcoin, but this object is way smarter and way more capable of solving healthcare issues than any cryptocurrency can do. And that is why we have absolutely proven at SolveCare that whether you are trying to improve clinical trials, or you're trying to coordinate disease, diabetes care better, or you're trying to do at-home care or remote patient monitoring, or you are trying to do more effective billing, or you want to get rid of this hated pre-authorization and referral management systems, anything you want to do in healthcare, when you look forward to a better, more interesting way of running healthcare for the betterment of the patient and for better efficacy and less stress for the provider and more value for the money spent, then you can deploy these digital assets called care cards and automate or even eliminate a vast majority of things that we don't like about healthcare. And at the same time, we can enhance things that we do want to enhance, like patient engagement, patient education, follow-up, symptom reporting, reminders for annual checkups, prescription compliance. All of those objectives that we have now become much easier, because if you can imagine this exchange of cards or digital assets between people, then you can, on that strength of that exchangeability and peer-to-peer communication, redesign everything that we do in healthcare today. When you lay out these cards in a sequence, you can create really powerful networks. So we have worked with clients, be major medical universities or hospitals or pharmaceutical companies or medical transportation companies, and we have redesigned the business processes within weeks. In one particular case, we have seen a very large investment that they had been making in a very large IT vendor for now 18 months before we stepped in, and in about 4 weeks had completely replaced this cumbersome, expensive, still in development patient engagement system with a new care journey made up of about a dozen care cards, and they were up and running. So this is the difference between a highly centralized Web 2 technology-based system that you are familiar with, that you use every day, and this Web 3-based, decentralized, highly configurable technology that is inherently secure, inherently encrypted, inherently immutable. And as long as you can grasp the concept of care cards as digital assets that you can move on between wallets, you can pretty much take advantage of it to solve any healthcare issues you have. So some examples of what kind of business processes can be automated using digital assets that are multidimensional. Appointment, instead of having you to make an appointment, you can easily publish an appointment availability card like Calendly. And as part of that card, when the patient interacts with your card, they can also be told whether they qualify for a subsidized care, or whether they need to make an upfront payment, or whether they need to be informed of what their office visit will cost. Hospital admission management is another example. Authorization and referral assets, care coordination, case management, claims submission and adjudication, clinical trials, consents, coordination of benefits between multi-party payers, discharge management, eligibility, enrollment in public programs, medical records, teleconsultations, you name it. Each of those business processes and human-to-human interaction that we struggle with today can be simply configured in the form of a digital asset that moves between your wallet and mine. And whatever you configure using a product called Care Labs, you can see it immediately in your wallet. It's not some theory. You can create and publish new care cards within minutes, and you can see how it's going to look in your wallet and how it's going to look in the receiver's wallet. So I have, let's say, configured a digital asset called How Are You Feeling Today, which is asking my patient, what kind of issues that you are experiencing well before you walk into my clinic. And in that scenario, the How Are You Feeling Today card can be configured, sent, immutably retrieved from their wallet, I have now consent to look at their data, as well as I have received payment for their upcoming visit, and I understand exactly what they're coming in for. They can look at my availability card and pick the time when they want to come in. They can see the appointment history with me. These are just simply different assets. And if they don't have the ability to come see me, I can send them a prepaid digital card, which gives them access to Lyft without even having to download the app. And a card will appear at their doorstep, for which my wallet can be automatically withdrawn. These are all cases that have been implemented in reality in different countries, in different systems. But my point here is, if you can imagine it, you can probably configure it yourself or with our help within minutes, what kind of an asset you want to send or receive from your counterparties. And to design these assets, we have developed some really cool technology called Journey Board. And the idea is that's cool technology called colorful crayons that we learned when we were 2-3 years old. So the objective is to actually be able to draw on a laminated journey board the journey that we want to create with our patient or our provider or our pharmacy or our nurse or our lab or our payer or employer, doesn't matter. And by designing this journey board in a few minutes, we can convert that journey board into an asset class and publish those assets in the wallet literally the same day. Now, this sounds all very good. This notion of a digital asset that's highly programmable, multifaceted, visually appealing, and immutable and secure and encrypted, and you can configure the asset to whatever you want. But how does this look from a patient or provider experience? So the good news is that this one wallet, Care Wallet, can connect to as many digital assets as the wallet holder wants. The same wallet can connect to an insurance company card from an eligibility point of view or from a deductible point of view. The same wallet can connect to a hospital system, and the same wallet can connect to a pharmacy or to a lab. And no one needs to learn to play with different websites. Nobody needs to learn to have different logins and passwords. Nobody needs to remember where to go, which URL to type. Everything appears in your wallet. You receive and send all assets from one wallet, which means that as long as somebody knows my wallet address, they can send me an asset, I can respond to them, or I can request a payment, they can send it to me. Everything happens in a single wallet. It's like having your own Web3 address. It's like having your own digital avatar always on, and it's able to interact with any other wallet in the world. And your ability to interact with the wallet is still peer-to-peer and secure, but I don't need to know anything about you to be able to interact with you. Of course, I may want to know something about you, and I can request your identity card and see who you are, but I don't need to. So this notion of zero knowledge is built in. I only need to share what I need to share with you. I don't need to tell you the name of my dog to get a certain service from you. In some cases, that may be necessary. In other cases, I don't care. So this whole relationship becomes reasonable. The whole relationship between every party in healthcare becomes more equitable, more logical, and most importantly, simplified, where I don't need to remember or interact with armies of people or to remember their URLs or to go searching on their website for their provider directories or to log into their systems or to do eligibility. That eligibility data gets turned into a card asset and sent to me or into the patient's wallet. So there's no need for me to call anyone and request any information. I can just ask the patient, please show me your eligibility asset, which if it comes stamped with the insurance company's digital signature, I don't need to know anything more. We are good. So there are many use cases, as I mentioned. I will skip through the video in the interest of time, but we'll post this video in the archive so you can actually take a look at it. But this shows how two wallets can interact, but you can have any number of wallets interacting with each other at any time. There's no limitation. I could be talking to 5 wallets at the same time or 500, but this video shows you interaction between 2 wallets. Now, what we've been doing is really innovative. This is not status quo or some slight tweaking of the status quo. What we are doing is really changing the paradigm of how we do healthcare in the United States, in Europe, in Asia, in Latin America, in Middle East. We see healthcare as needing a significant upgrade because the provider needs to be able to focus on delivering care. not administering care. Administrators should be administering care, not having to manage care. And patients should be able to get care without having to get a PhD in clinical or administrative processes. So we have reimagined healthcare by saying, look, why don't we learn to use digital assets to simplify the most painful parts of healthcare and rely upon blockchain as the trusted signature authority. So when an asset is published here with a trusted authority, then no further verification is needed. Parties can trust that signature because it belongs to a wallet, and that wallet belongs to a trusted entity, be it government, insurance, hospital, pharmacy, lab, patient, provider, whoever. So this innovation has landed us on the top of innovative lists around the world. We have more awards than we can possibly list here, but that's what makes the crossing of the intersection of cryptocurrencies, or what I prefer to call digital assets, with healthcare so exciting, so rewarding, because there is not a problem in healthcare that cannot benefit it directly or indirectly through the use of a peer-to-peer secure digital asset exchange rather than paper, fax, email, text messages, or medical records, or phone calls. We replace all that with simply a configurable digital asset exchange. Now, it's your turn. Bring us a problem, any problem, be it medical records, be it care management, be it case management, be it billing, be it payments, be it eligibility verification, be it provider credentialing. Bring us a problem, and we will run a free workshop for you. And the workshop only takes 2 to 3 hours, and we will design a new asset class for you that will address that issue. And further, we will give you a design of a network that you can use to actually launch your own digital health solution. So bring us a problem, and we will help you build a solution or design a solution for that problem for free. Now, a few questions that you probably have in mind. What about EMRs? What about them? You need to connect with them. You simply transport the HL7 message into an asset. You want to convert asset into HL7 message? Fine. You're on Fire? Fine. We'll take the Fire resource, convert that into an asset. We'll take an asset, turn that into a Fire resource. You are on a legacy system. You don't have any of the current APIs? Fine. However, you can export the data, including screenshots or PDFs. We'll convert into a different digital asset. There is HIPAA. What about HIPAA? Well, we exceed all the standards of HIPAA, because HIPAA is talking about consent-driven record sharing for the right reason, for the right duration, by the right person. But you can't violate those rules in a digital asset world, because every wallet has a role and an identity. And if that role and identity is not permitted to do certain things, then you just can't do them. And every transaction, every sharing, every viewing of records or digital assets of any kind is on the blockchain. So we can always trace it backwards. So we exceed the letter and the intent of HIPAA. And same is true for GDPR. And same is true for any Patient Protection Act or patient rights or physician rights regulation that exists in the world. Because those are all written with the idea that some party controls the data, and we all have to prevent that party from abusing that power. In our world, no party can abuse their power, because their role and their reactions and their relationships are on the chain, and they're fully auditable, and therefore they cannot be hidden. So it's impossible to violate the rules and not be caught immediately. So again, I come back to, it's your turn. Whether you're running a hospital, or you're running a pharmacy, or a provider network, or you're running a clinic or a practice, or you're a researcher, or you're a university, hospital, or a government agency, or a benefit administrator, or an employer worrying about employee health, and you want to run a wellness program, whatever your issue is, bring us the problem. We will run a workshop for you, and we will show you how digital assets in a properly configured network will solve that issue. We haven't met a problem yet that we can't solve. I hope you can bring us your problems, and we will see how we can help you. Find out more about us on solve.care, or info@solve.care is our email, or go to Telegram and join our huge global community where everybody's talking about all the different use cases of SolveCare on Telegram, or simply reach out to Tori, and she'll be more than happy to connect you to us. Thank you, everyone. I hope this was helpful. And when I wrap up with the final thought. Healthcare is essential. Its effective functioning is a barometer of society's effectiveness. Our physicians are our greatest asset, who we cannot afford to burn out, although we do a pretty good job of doing that. And we must look at healthcare differently and not just talk about why healthcare is not functioning as well as it should, but rather take a concrete step towards improving it. That's been my mission. That's the mission of my company, SolveCare. And that's where we believe digital assets hold such a great promise. Now the promise is in your hand to take advantage of. Thank you, everyone.